Chronic vaginitis is really a broad array of conditions that cause chronic itching, chronic burning, chronic pain with intercourse. It's a type of problem that affects women of all ages. So we basically see women who are referred by primarily their gynecologists because they've had chronic issues that have not gone away with treatment and they keep coming back, or sometimes they're conditions that are refractory to all treatment. There are no good population-based studies to say how common chronic vaginitis is. For yeast infections alone, the estimate is that maybe 5% of women have recurrent yeast infections, which is a pretty big number. For vulvodynia, which is another condition I mentioned, the estimate is somewhere between 6 to 10% of women. So again, quite a large cohort of women. Basically, these are conditions that affect women of all ages, and it's actually a wide array of different types of conditions. So in younger women, frequently they may have an infection like recurrent yeast infections. They might have bacterial vaginosis, but then there's skin conditions that they can get like a dermatitis, or sometimes there's a condition called vulvodynia that causes pain with intercourse. In older women, we see a lot of women who have atrophic vaginitis and who need estrogen. There are different skin problems like lichen sclerosis and lichen planus that they can have as well. And so it's really a broad array of conditions. In terms of clinical care, we're a busy program. I think we're up to women from 40 states and 5 continents who've flown in to see us. There's actually a really nice program in Australia, so I'm not sure we'll ever see anybody from Australia. And I'm not sure that chronic vaginitis is that common in Antarctica, so I'm not sure we'll be seeing anybody from there. So these problems are very common. Our active referral base is between New York City, Baltimore, and Harrisburg, which is in central Pennsylvania. And between Catherine Smith, who's a nurse practitioner who works with me, and we see probably 30 new patients a week. So it gives you a sense of how common these problems are. You would think that vaginitis is a really simple issue, and it turns out that there are a number of barriers. One of them is I think there's a barrier to diagnosis, and so just as an example, by the time they get here, 95% of the women come here with the chief complaint of having yeast infections. Only a quarter of the women that we see actually have yeast infections, so there's a lot of misdiagnosis. Some of them is because they've self-treated themselves so often. I think their providers never get a fair chance to make an accurate diagnosis. Sometimes I think providers can make an inaccurate diagnosis because sometimes the reflex if somebody complains of anything wrong in the vagina is to say, oh, it's probably a yeast infection, just take a treatment. And then there are also ways of approaching yeast infections, for example, that can make a big difference. And so just as an example, not all yeast infections are the same, but about 2/3 of infections that we see here are due to Candida albicans, which is the most common type of yeast. A very effective treatment algorithm for many of these women is to treat them with 6 months of fluconazole. Most providers are used to maybe 1 pill of fluconazole or 2 pills of fluconazole, but if you treat for a long time, it suppresses the infections very nicely. They're asymptomatic. The risk of recurrence drops down to about 30% versus 80 or 90% if you give them a short course of treatment. The average patient has seen 5 or 6 doctors before they get to us, and on average has had 1.5 to 2 years worth of symptoms. So these are women who have really looked at a whole array of options and just haven't gotten better. Or if they get better, it's just really temporarily and then everything comes back. And you would think this is a trivial problem, but it's really it has a huge impact on quality of life. Taking again the example of yeast infections, I have some women who are happily married but haven't been able to have sex in a couple of years because just by the time their first infection clears and they think they're comfortable enough to have relations, the next infection comes along and they're right back to where they started. So these types of problems can have a huge impact on quality of life.